arteries, the sinuses, all the three, they would be black or dark both in T1 as well as T2. So the caudate nucleus and putamen, they can much easily be differentiated in case of T1, but it becomes slightly difficult to differentiate them in the T2. So water CSF would be bright, hyperintense, and white in case of T2. So next one is T1 and T2 MRI images appearance in various structures in the spine. So similarly, in T1, the CSF would be dark, the bones would be dark, the fat would be bright, and the intervertebral disc, they would be intermediate. And in case of T2, the CSF would be bright. So previously, the CSF was dark. In case of T2, the CSF would be bright, and the fat is bright in both T1 as well as T2, and both bones would be dark. So you can see here the fat particles. The fat particles is appearing as a bright. This is the spinal cord. The spinal cord is usually iso-intense, and in front of the spinal cord we can see the CSF. So CSF would be dark or black in case of T1, and it should be bright. You can see here the CSF is bright. The CSF is bright in T2, but in case of T1 it should be black. And the bone marrow would be intermediate since it contains very low amount of fat. And the muscles will also be intermediate, as well as the intervertebral disc. So intervertebral disc, this is usually iso-intense. The intervertebral disc is usually iso-intense, and the bone marrow and the muscles, they are usually the intermediate. So is this T1 or T2?
T1. T2. CSF is black.
Where is the CSF?
Oh, sorry, T2. That's the spinal cord, not CSF, in between.
Yeah. So this one is the spinal cord. Okay, so don't get confused. So these are the CSF. These are the CSF. So this is bright. So this is the T2 component. So this one is the spinal cord. This is not the CSF. So in case of cervical spine, look at this carefully. This is the spinal cord. So next one is T1 MRI images of the lumbar spine. So similarly, the spinal cord, it will appear as black. The CSF would be dark. The fat would be bright. Muscles would be intermediate. The ligaments would be dark. So memorize this. The ligament would be dark in T1. And the intervertebral disc, this is usually iso-intense. And in case of T2, the CSF would be bright. The ligament is also dark. So ligament is dark both in T1 as well as in T2. So whenever there is any abnormalities, any tearing or inflammation in the ligament, it will appear as hyperintense, whether in T1 or T2. So next one is T1 and T2 MRI images appearance of various structures in the head and neck. So CSF is dark in T1. And the fat would be bright. The bone marrow contains fat, so it will also be bright. The bones and blood vessel, whether this is T1 or T2, they would be dark. So bones, the blood vessels, they would be dark. The CSF and fat components would be bright in case of T2. So this one is T1 MRI image appearance of the neck. So the teeth will also appear as dark, and the fat would be bright. The CSF would be dark. And this one is the T2 MRI image appearance of the neck, and also the CSF would be bright. So next one is T1 and T2 MRI images appearance of various structures in the pelvis. So what should be the color of ureter? The color of ureter in T1, and what should be the color of ureter in T2, or urinary bladder?
T1, will be hyperintense, and in T2, it will be hyperintense.
Yes, excellent. And in case of synovial fluid within the hip joint?
Same. Hypointense in T1 and hyperintense in T2.
Yes, very good. So we'll always remember with regards to the water or fluid type of components, they would be dark in T1, whether this is CSF or this is urine or this is synovial fluid. All types of fluid components, they would be hypointense in case of T1, and they would be bright or hyperintense in case of T2. So in case of T1, the fat would be bright. The ureter, it would be dark, containing the urine. The synovial fluid would be dark. The urinary bladder filled with urine, it will also be dark. And in case of T2, the urinary bladder containing fluid would be bright. The ureter containing urine would be bright, and synovial fluid will also be bright. So is this T1 or T2?
T1.
So the urinary bladder is dark. So this is T1. And in case of T2, so look at here, this is not contrast. In T2, the urinary bladder will look as an hyperintense. So looking at the bladder in case of pelvic MRI, so if the bladder is black or dark, this is T1. And if the bladder is hyperintense or white, this is T2. So T1 and T2 MRI pathology appearance. In MRI, the signal intensity of tissue or pathological processes on T1 weighted and T2 weighted image is determined by relaxation properties of hydrogen proton within them.